few seconds. Sir.
Yeah. No, it's for the time. Not I can put it in airplane. No.
Yes, I have it for that. Thank you.
Namaste and welcome to the first episode of COVID Care series by Apollo Experts. The second wave of the pandemic has sent the community scrambling for information. The medical community is continuously looking for evidence-based data on treatment of COVID-19, drugs that can be prescribed at different stages, management of patients, protocols to be followed, and more. In such an evolving situation, it can be very difficult to find one source of information that can be trustworthy. So Apollo Hospitals Group is addressing this issue to deliver trusted information that will help the community at large in meeting the challenge of the second wave of COVID-19 with a Facebook Live series that will cover various aspects of COVID-19, the new variant symptoms. Drawing on the legacy of Asia's largest integrated healthcare institution, the video series will have specialist doctors from all across Apollo hospitals sharing their experience and expertise to guide and answer all queries related to COVID-19. So today we have Dr. V Ramasubramanian, infectious diseases specialist at Apollo hospitals, to talk on the topic COVID-19 second wave, new variants and symptoms. He has over 30 years of experience and he has played a pioneering role in establishing infectious diseases as a specialty in India. So over to you, Doctor. Can you please talk about the topic? Thank you.
Good afternoon, everybody. We are in a crisis right now, and it appears that the second wave is probably more intense than the first wave. Now, this is not something which was unexpected. The coronavirus, or the SARS coronavirus 2, is what we call an RNA virus. You know, there are mainly two types of viruses, DNA viruses and RNA viruses. And this RNA virus, which typically used to cause colds in humans, has now undergone a change whereby it is able to infect the lung cells and cause a pneumonia. And that is the reason why there is a high level of deaths occurring due to SARS coronavirus 2. Now, mutation is a biological process of evolution which happens in all viruses and typically seen in RNA viruses. Now, as I said earlier, it is not surprising that we have had a second wave because of 2 or 3 main reasons. When we had the first wave last year during the summer and autumn times, it was predominantly a time when most of us were under quarantine. So in spite of being in quarantine, the disease caused a first wave, which was very slow to rise in India. And then by the end of the year, we came to grips with it and it came down. But now, because of 2 reasons. One, the governmental restrictions have come down because the government realized that there is a significant loss of livelihood if there is an ongoing quarantine or ongoing lockdown. The restrictions have come down, so businesses have started as usual, restaurants are open, travel has commenced, and they have also started gatherings, including marriages and the Kumbh Mela. So all this has contributed to a crowding, and when a virus enters this situation, it definitely is likely to cause a problem. The second reason is what I would address as pandemic fatigue. All of us are now in a situation where we are just fed up with staying indoors, fed up with using masks all the time, avoiding crowds, and staying away from malls, shopping, and restaurants. Now, this is, again, I said, is not something uncommon. It is bound to happen, and the pandemic fatigue, along with the relaxation of norms by the government, and add to it this cocktail, a third issue of variants happening in the virus. Now, as I told you before, the virus, the RNA virus, has a natural tendency to undergo changes. When it multiplies, because the system of checking the multiplication is not very robust, the chances of aberrant viruses or viruses with different genetic changes which can happen is high. Now, mutation refers to a change in the genetic structure of the virus. So these mutations can happen, and when these mutations happen several times during a multiplication of a virus, this can lead to a different strain of virus, what we refer to as a variant. So variant virus is a virus which has 2 or 3 changes in the mutation or the genetic structure of the virus, which gives the virus an added benefit of survival. Now, this benefit could be in the form of increased infectiousness to the humans. It could be a resistance in able to withstand the protective effect of the virus, or it could also be related to the therapeutic process where the conventional treatments may not control the virus and the virus may spread unchecked even within a single person. So when you add the lifting of restrictions, the pandemic fatigue, and the changes of mutation happening in the viruses, this can lead to a deadly combination, which is what has happened now, and led to a phenomenal increase of cases leading to the second wave. So this has been seen in Europe, in the United States, and again, it was just a matter of time before it came to India. So we have been seeing several types of these mutations. The first one which was recognized, a major one which was recognized, is what we call the UK variant, United Kingdom variant, which came about towards the end of last year. And it was believed that this variant, the UK variant, which is termed as B117, had the ability to be more infective than the earlier strain. So the chances of the disease spreading was much greater. Since then, we have identified 3 or 4 main kinds of variants. One has been the South African variant, which, apart from infectivity, which is believed to be higher than the original strain, also has the ability to evade the immune response which a vaccine can create. Typically, the Covishield vaccine, when it induces an immunity, the South African variant can escape this, so the vaccine becomes ineffective. We also have had subsequently a Brazil strain or a Japan strain, and recently we are also seeing a variance in the Indian infections, which we have noticed in the last couple of months. Now, this strain, which has been noticed in India, actually has 2 different kinds of mutations in 2 different areas, genetic areas of the virus, which have probably some combination of the UK and the Brazil variant. It is called this B1617, that is the numerical given to it. And it is also called the variant of concern because it is believed that these 2 kinds of mutation, what is referred to as a double mutation found in the same virus, can somehow increase the infectivity. So it spreads faster and also probably gives it some benefit in causing more damage to humans. So it is believed that we still have a lot to learn about this double mutant, but it is believed that these changes have come together, and the occurrence of a double mutant in India is the reason why there is an unchecked progression of increased number of cases in our country. If we need to tackle this, we need to know more about the virus. So we need to do more genetic studies to find out what is the prevalence of this strain. We need to learn more about how infective it is and whether it will be able to evade the vaccine induced immunity. We currently have 2 types of vaccines, the Covishield and the Covaxin. We still don't know whether the new double mutant can escape the benefits which the vaccines may provide. And most importantly, irrespective of whether it is able to evade or not, we need to ramp up our vaccination administration, because it has been seen even the viruses which have been able to escape somehow the vaccine induced protectiveness, like the South African variant, do respond minimally to vaccination. So unless we get the immune response of the entire population up as quickly as possible and vaccinate as many people as possible, I think we will not be able to keep this virus in check. Along with that, we need to throw in, of course, I don't believe in radical lockdowns, but focused areas of control in zones where there is an increased occurrence of infections, ensure that travel is restricted, ensure that masking, hand hygiene, and physical distancing is strictly implemented. So with these measures, I think we should hopefully be able to bring this process in check. You're muted, Doctor.
I was just saying that thank you, Doctor. It was really informative. In very simpler terms, it's been very explained very well for the general public to understand. So we do have few questions. So the first question is, what are the symptoms of this new COVID strain, and how is it, the symptom-wise, how is it different from the first wave?
We have already realized that even though the SARS coronavirus is predominantly a respiratory virus, the symptoms are not limited to cough and fever. We do find that the SARS coronavirus can affect several organ systems, and the symptoms may vary anywhere from diarrhea, nausea and vomiting, loss of smell and sometimes taste, extreme lethargy, and sometimes because of the clotting, the blood clots which the virus can induce or increase the risk of, you can get heart attacks, strokes, and several other complications. Personally, I have not seen a significant difference between the symptoms occurring between the first and the second wave, but there are reports of increased possibilities of conjunctivitis, increased occurrence of drug rashes, hives like urticarial rashes have been seen, and of course, the same old complications along with more gastrointestinal symptoms in the form of diarrhea, nausea and vomiting, dizziness have all been reported, but none of these are specific to identify first versus second strain. There is a conglomeration of symptoms which can affect several organs in the body.
Right. And coming to age, age group of the patients that are being affected, doctor. So it seems to be significantly different from the first wave to the second wave. See a lot of young people and children who were not majorly affected the first time around seem to be getting affected. So can you please comment on that?
Yes, we definitely have seen an increased incidence of infections in younger people, including children. But again, my interpretation of that is, it is not that the virus has become more virulent and causing problems. During the first wave, everybody was protected. It was only the working class which went out because they had to make a livelihood. Anybody who could work from home continued to work from home. And a majority of the population was protected. People were more anxious and worried at that time. People had the ability to do work from home and keep their children protected out of school area. In general, the exposure to younger people was also much lower. But now parties have started, marriages have started, schools have opened. Now all this is making the incidence of infection in younger people much greater. Having said that, again, I would like to reassure people saying it is not like younger people are coming down with serious infections and they are doing much worse than before. It is just that when the numbers increase, a small percentage of them will there is a possibility that they will become unwell and need hospitalization. But I have not noticed a dramatic increase of severe infections in young.
Okay. The next question is COVID-19 reinfection possible?
Absolutely. We know very well that, especially in people who have a mild infection, the antibody response is not very robust. And when it is not robust, they can get a secondary infection. A lot of times a second infection or reinfection is mild, but I have seen several people who have had a severe second infection. Similarly, even with vaccine-induced immunity, there can be infections happening subsequently, but fortunately, most of them are mild. So the immune response after a natural infection or a vaccine-induced immunity is definitely protective, but is not foolproof in the sense that it doesn't prevent infections totally. It's not.
Okay, so there's no time limit between the reinfection phases. So there's nothing there is no set pattern is what you're...
Usually reinfections can happen after 3 months when the immune response created by the first infection or the vaccine starts waning. So typically beyond 3 to 6 months is when we start seeing reinfections.
Right. So you did talk about the protection after having the vaccine. So how long does it take for anybody to develop that immunity after they have taken the vaccine doses?
Now, please remember, as I said, that vaccines do not prevent infections completely. They significantly reduce the occurrence of infection and almost 100% prevent occurrence of serious infections. You have to understand that the vaccine response is not 100%, but very, very high, upwards of 80 to 90%. And when you take the vaccine, again, I would like to reiterate, the immune response is believed to be effective only 2 weeks after the second dose of the vaccine. What we see is a number of patients who have had 1 dose and within 1 or 2 weeks come down with the infection. A single dose of the vaccine does not give enough effective immune response to prevent the infection. So 2 weeks after the second dose of any vaccine series is when we believe that there is some immunity which could be protected.
Right. So the next question is, it's kind of related to what you've been talking. Do the COVID vaccines protect against the new variants/mutants?
The vaccines have shown to be very effective. to the conventional virus which came from Wuhan last year. And with every mutant or variant which we are seeing, there is a possibility that vaccine effectiveness may not be as ideal as the original virus. It has been shown that for the UK variant, the vaccine is protective, but the Covishield is unfortunately very poorly effective against the South African variant. We still don't know, but there is reasonable evidence to say that the newer vaccine, for example, Covaxin, is probably protective against that. And maybe the newer variants, the double mutant which we are seeing in, probably the Covaxin is effective. But it's still too premature for me to categorically say. But the good news is, even if the vaccine effectiveness is less with the variants, it does give some amount of protection. That is the reason why I insist that all of us need to get vaccinated as soon as the vaccine is available and we are eligible. Sorry, I think you're muted.
Yeah, sir. So pretty much we are covered with questions, what I see so far, but I see that probably something more, I mean, like people are asking questions, so we're just taking a look at it.
Now, let me start with one of the questions which a lot of people ask me about the safety of vaccines. You know, I personally don't understand why there is such a lot of hesitation, even amongst the medical healthcare workers regarding vaccination. These vaccines are very safe. The only significant side effect, apart from the anaphylaxis, which has been seen typically with the Pfizer and Moderna vaccines, which are not available in India, the Covishield or the Covaxin has no significant anaphylaxis. But what has been seen is that the Covishield vaccine can induce low platelets associated with an increased risk of clotting. Now, this has been seen in only about 19 to 20 cases among several million, whereby they predict that the occurrence of such risk of clotting is 1 in 250,000 to 1 in a million. So we are looking at very small numbers, seen more often in younger people, seen more often in women. So typically women under the age of 30 are probably at a higher risk of this Covishield-induced clotting disorder associated with low platelets. This can be serious, this can lead to deaths. So if younger women have an alternative to Covishield, we need to advise that. But if you look at the benefits of the vaccine in total, the risk of COVID causing clots and death is several times, 5 times more than the risk of this. And the benefits overall is much, much greater. So we need to be careful as to what we advise. Elderly people, you don't need to worry about what vaccines. If you have already taken one Covishield, if it is young people, the problem doesn't happen with the second dose. It always happens with the first dose. So if you have taken one dose and you're worried about taking the second dose, don't worry, it is perfectly safe. But if you have not had the vaccine, if you're under 30, and especially a woman, try to look for alternatives to Covishield. That's all we can say.
Okay, so the next, doctor, is there's a new strain called as triple mutant in West Bengal. So can you comment on that, please?
This is going to be inevitable. We'll have a triple mutant, we'll have a quadruple mutant, we'll have a quintuple mutant. This is going to evolve with time as the virus becomes smarter. Okay, it doesn't mean that every time we have a mutant that is going to be a super mutant, in nature. It is not necessary that all the mutants will give additional powers to the virus. So I wouldn't worry going around the way. Mutations are inevitable. It's going to happen more and more with time. We need to be cautious. We need to be proactive in detecting it and changing our vaccine production to cover these mutants. But it's like buying the latest cell phone. You'll never buy the latest cell phone. You buy one, within a week, you'll have a new cell phone which will have added features. It's like that. So the mutation is going to develop. But I again insist, please get vaccinated, because the benefits of vaccination, even though may not be 100%, still is any day better than going through the disease.
So we have a question from Ms. Ambika, who says, I got discharged 19 days back after COVID treatment. When should I take the vaccine?
A minimum of at least 2 to 3 weeks is advised. It is believed that you can probably wait anywhere from 6 weeks to 3 months before you can have the vaccine, because as I said earlier, the immune response created by the infection will definitely be there for 3 months. So I would say somewhere in the region of 2 to 3 months, you can consider the vaccine.
So there's the next question is a new mother, breastfeeding mother positive with a 3-month-old baby. So she's asking if she needs to check for RT-PCR. If it turns out to be positive for the baby, what are the medications that need to be started? As of now, the baby is asymptomatic.
I wouldn't worry about testing asymptomatic babies or adults at this point unless there is a risk of exposure to someone or they live in the same household of somebody who's tested positive. So if
the mother is positive, doctor.
Oh, the mother is positive. I'm sorry. So the usual advice I suggest is I don't routinely advise checking asymptomatic contacts. As long as you quarantine or isolate all the exposed people within the same household for at least 10 days, you need not worry. Otherwise, do the test after 7 days for asymptomatic contacts. If the test is negative, you need not worry anymore. If the test is positive, you need to continue the isolation. But the good news is generally even young children do very well, so there is no need to panic.
The next question is what is the dosage of vaccine that is required for effective protection? So that's something which you have addressed already.
Current recommendations are 2 doses for most vaccines except the J&J vaccine. The interval varies for Pfizer, it is 3 weeks, for Moderna, it is 4 weeks, for Covishield, it is anywhere from 6 to 12 weeks, for Covaxin, it is 4 weeks. So adhere to the manufacturer's recommendation and don't mix vaccines. If you take first dose of one vaccine, the second dose also should be of the same vaccine.
The next question is, if anyone has allergic reaction to paracetamol, can they take the vaccine?
Absolutely. The risk of anaphylaxis has been hyped up because of the increased anaphylactic reaction seen in patients who receive Moderna and Pfizer vaccines, which are mRNA vaccines. A similar kind of anaphylaxis has not been seen in other vaccines. There is no cross reaction or relationship between allergies to foodstuffs, allergy to other medicines, which will preclude taking a vaccine. Only if you have had an allergy to an earlier vaccine, you need to avoid vaccines because the adjuvants or the stabilizers used in vaccines may induce allergic reactions.
Say someone's niece is about 3.5 years old and has been tested positive. What is the impact on the child?
Nothing. Children do very well. Keep a close watch. Give paracetamol. Give symptomatic treatment. Children, there is a small possibility in young children that they may develop an inflammatory syndrome after recovering from COVID, what is called as MISC, multi-system inflammatory syndrome in children, which is an inflammatory response to the COVID typically seen in young children after they recover from COVID, where they may present sometimes with serious reactions, including diarrhea, breathing difficulty, high fevers, joint pains. That has to be looked for. If they develop any symptoms like that, they need to be hospitalized and given treatment with immune suppressing medications like steroids or IVIG or intravenous immune globulins.
So Ms. Aisha's friend has infection and has bloody sputum. CT scan is normal. Is there anything that needs to be done on the 14th day of infection?
Nothing.
So there are 2 questions which I'm going to mix up, doctor. There's one, skin itching is a new symptom and mild symptoms like diarrhea without fever. Are these new symptoms?
No, this was seen during the earlier first wave also. As I said, this COVID somehow affects the gastrointestinal system because the receptors which the virus attaches to are seen in the GI system also. So diarrhea, I've seen people come with only diarrhea for a week who test positive. Some people have diarrhea and vomiting. Some people, as you said, have hives or urticarial rashes, which are itchy. Some people develop something like chilblains. They may have difficulty or they may have problems with blood flow in the digits of the feet. So all this can also be seen with COVID.
Can a pregnant woman take vaccine?
The vaccine is actually not licensed for pregnant women because the tests which permitted the licensing procedure did not cover that. But it has been shown very clearly that pregnant women can have a higher risk of developing complications when they develop COVID. Though it is not as bad as influenza, though the risk is still higher when compared to non-pregnant women. So, and the vaccine is safe. It does not cause any reaction. So yes, if there is an outbreak going on, please vaccinate pregnant and breastfeeding mothers, lactating mothers, because the benefits are definitely more than the risks, which are conjectural.
That's all we have the questions for the day, doctor. Thank you very much for patiently explaining all the questions. And the topic has been very informative. Thank you for your time. have the next thing. Sorry about that. Watch out for our next session tomorrow at the same time on topic COVID care management at home versus hospital by Dr. Rajiv Paul, internal medicine physician at Apollo Hospitals. And if you have any more queries, please reach out to us to Facebook Messenger or post them in the comment section. All of you take care, be safe. Don't forget to SMS S for social distancing, M for mask should always be on, and S for sanitization. Thank you for your time and namaste.